So my project was titled Decisions and New Dimensions, Exploring the Double Mastectomy Choice for BRCA1 Carriers Pre and Post-Surgery. So introduction. So exploring the decision-making process and outcomes for BRCA1 mutation carriers who choose to undergo the prophylactic double mastectomy was my topic. And I mainly discussed what factors influence the decision to undergo double mastectomy, what are the emotional and psychological impacts before and after surgery, and how does this surgery affect long-term quality of life. My research is significant because it sheds light on the difficult decision-making process that BRCA1 carriers face regarding double mastectomy. So a literature review. So there is an article that was published recently by Honor Whiteman that was titled "For Women with BRCA Gene Mutation, Double Mastectomy Better?" And it discussed the effectiveness of double versus single mastectomy, impact of BRCA mutations on cancer outcomes, recommendations for clinicians, and future directions. So the effectiveness of double versus single mastectomy discussed double mastectomy and how it was linked to 48% reduction in breast cancer deaths compared to single mastectomy, and it improved 20-year survival rates, 87 for double and 66 for single. And the impact discussed BRCA1 and BRCA2 mutations and their increased susceptibility to breast cancer. And it also suggested discussing double mastectomy as a treatment option for young women with BRCA mutations and early-stage breast cancer. And basically advocated for increased genetic testing and for breast cancer patients. And it planned to kind of study the combination of bilateral mastectomy with oophorectomy or inhibitors. And it explored the benefits of hormonal therapies in BRCA mutation carriers. So methodology and results. So it analyzed outcomes and decision-making processes of double mastectomy in BRCA1 mutation carriers. So I reviewed survival rates, compared death rates from breast cancer between patients who underwent double mastectomy and those who had single mastectomy or no mastectomy. And I examined genetic and clinical factors that influence treatment decisions, and I reviewed reported post-op effects. The analysis showed that while double mastectomy significantly impacts the chance of an individual developing cancer, it also brings negative impacts. So, for example, the analysis, though it showed that it reduced breast cancer, it only showed the published results. So we can't take into consideration every single person's experience with undergoing the surgery and whatnot. So it can't the findings of my research can't be generalized to the general public. So conclusion. So what are the outcomes and decision-making processes associated with prophylactic double mastectomy in BRCA mutation carriers? So the analysis shows that while double mastectomy significantly reduces the risk of breast cancer, mutation-related cancers, which is up to a 90% risk reduction, it also presents challenges such as mixed emotional response, high levels of post-op depression and anxiety, body image issues, and also with this research, I hope to have highlighted the need for more effective and holistic emotional support networks and adequate pre-op education for better patient satisfaction. Thank you.
Excellent job, Meghna. You want to share your experience about the program?
Yeah. So Professor Prahlad's kind of in our first couple lessons, he went over the very in-depth scientific aspect to all of our research topics. And I feel that really provided a very strong foundation for all of our research and where do we start and helping us even decide a research topic. And I feel Professor Virgil's expertise in writing really helped me get my point across. It's one thing to research something and just brain dump onto a doc, but it's another thing to write it in a way that's understandable to everyone and hopefully achieve what we want to achieve through our research. And my overall experience with Gifted Gabber was very informative and very good. The whole program was very structured and frankly helped me finish my research paper. So yeah.
Excellent, excellent. And Meghna is multifaceted. She has a lot of things. She's very passionate about chess and she has wonderful activities going. So thank you, Meghna. Question from Professor Prahlad.
Yes, Great job, Magna. Great presentation.
Thank you.
And the question is like, so there are a lot of trauma or with the decision making that's associated, right? So what would be one thing that you recommend maybe that will reduce that kind of trauma or help the patients with the decision making? What did your research find?
Um, I think, I mean, a lot of research that I was looking at suggested group therapy with people who are currently going through the process of deciding or just have underwent the surgery or just received their diagnosis. Like I feel like that, at least in the research that I read, it was really helpful to get to know everyone else's experience and kind of collectively reduce cancer anxiety. Because a lot of people who even did undergo or right before, like right after they received their genetic diagnosis, they like immediately like have an overwhelming fear of developing cancer. Although like the risk of developing cancer isn't 100% when you have a mutation,
Mhm.
they have the fear. So I feel like talking to other people who are in a similar position to you will really help kind of reduce that fear and help you come to terms with it.
Okay, great, excellent. Yeah, great job.
Thank you.
Congratulations.
Excellent.